Dr. Mahajan is experienced in health education, mental health training, and provides counseling for teachers and parents of children. Under the leadership and guidance of Dr. Mahajan, Project Inclusion is actively working across 21 states and union territories and has trained over 55,000 teachers and special educators across India. The project aims to empower school teachers all over the country to identify and support children with learning difficulties. Thank you, ma'am. Thanks for being here. Over to you.
Namaste. I, Dr. Simmi Mahajan, on the behalf of Sri Aurobindo Society, welcome our esteemed guest, our chief guest, and other panelists who are there, and all the audience who are connected to us through YouTube or other social media handles. And today it is the final activity of the Autism Month we have been celebrating. And the purpose of today's event and webinar is that bring all the stakeholders, bring all the experts who are managing autism and its comorbidities through conventional and unconventional ways. So, and as Project Inclusion has a mission of reaching to all the teachers of the country and reaching to parents and children of various learning difficulties and to create tools and all over. So, further, I'm not delaying further. So first of all, I'll be very happy to introduce our chief guest and the other panelists. So today we have Dr. Subodh, who is the chief guest of the event. And Dr. Subodh has over 33 years of experience in the field of disability. He has been working with Rehabilitation Council of India since 1998 and was the former member secretary and executive head of the council from 2019 to 2022. He has served in various capacities, including head of institution at the State Institution of Research, Training and Rehabilitation, Department of Social Justice, Government of Haryana. Dr. Subodh has developed course curriculum in special education and disability rehabilitation and has published various articles and papers in national and international journals. He had an opportunity to head the Indian delegation to visit University of Melbourne, Australia, and in April 2019 to attend the International Workshop for Development of Community-Based Inclusive Development Program. So I welcome Dr. Subodh. I hope Dr. Subodh may take some time to join, but let us continue and let me introduce our other esteemed panelists. So first I want to introduce Dr. Vikas Sharma. So Dr. Vikas Sharma is a pediatric occupational therapist. In a very short span of time, Dr. Vikas has made consistent efforts to improve the quality of life for his patients and is one of the renowned experts in the field. He comes highly recommended by pediatricians and parents and is loved dearly by kids. His knowledge and ability to diagnose is unmatched, but what sets him apart from the rest is his hands-on approaches and his compassion towards parents and children alike. So I welcome Dr. Vikas to the webinar. And next, our guest is Dr. Uttareshwar Pachegaonkar. Dr. Uttareshwar Pachegaonkar, who is MD in homeopathy, is presently the director at Sri Aurobindo Center for Homeopathy, Sri Aurobindo Society, Pondicherry. He is a visiting faculty member in Maharashtra University of Health Sciences and is also a professor emeritus in Sonaji Rao Sri Sagar Homeopathic Medical College. Dr. Pachegaonkar has presented papers at national and international conferences. The government of Maharashtra has recognized his work by awarding him a special medal for rural services in 1988. In Sri Aurobindo Society, Pondicherry, he has initiated several innovative research projects. So welcome, Dr. Pachegaonkar. And so our next panelist today is Dr. B.K. Bandre. Dr. B.K. Bandre is one of the most distinguished personalities in therapeutic and prophylactics aspect of yoga in India. He is the only person in the country to have been awarded a DLET in the research on asthma and allergies. He has a doctorate degree in yoga philosophy and is a fellow member of the Association of Natural Medicine UK. He is currently the yoga program advisor at Always Live Yoga. It is an app where thousands of users are connected um, and doing yoga practices. So again, I really welcome, heartiest welcome to all of you here and be here. And I'm very happy that Dr. Subodh has joined. And Dr. Subodh, without delaying further, I will be very happy that if the session you can start this session by sharing with us the role of RCI and your experience in the field of disability. Welcome to you, and over to you, Dr. Subodh.
Madam, namaskar and good evening to all of you. Actually, I am just dwelling through the mobile phone itself. I'm not very much familiar with this all the system anyway. So first of all, I must thank to all of you, especially Madam you and the Aurobindo Society for inviting me for this important 1 hour webinar and discussion, we can say. So this is a very like you have been saying, and this the topic, the intervention of autism and comorbidities, the very important topic actually. And since you have been doing this area in close education, so that's it seems to be very relevant. First of all, just ma'am, I would like to say, um, see, if you talk about the HRD and the human resources and number of training colleges and the other stakeholders, what are they doing? So if you talk about in terms of the Rehabilitation Council of India, of course, as on date, there are very limited number of training institutions, and of course, the special school for the intervention and the education training of children with ASD. And of course, moreover, it also needs the therapeutic intervention. And that's why actually other experts, doctors, pediatricians, and the neurologists, as well as the OTPT, they are involved in this area. And at present, actually, I have seen the brochure also. So many my panel speakers are there. They are having their own expertise in this area, and they have been doing all the intervention and diagnostic work. And the part that I'm not going to touch because this is their core area. And just since I have been invited, so just I will say, especially nowadays, actually, if we talk about the inclusion and inclusive society. So it also we are talking about the implementation of the RPT Act 2016. It advocates and it says about the accessibility and provide the inclusive environment for all the stakeholders, and especially for the children with disability and persons with disability. That actually, and under RPT Act section 16(1), it is also mandatory for all the state government, all state governments and the appropriate authorities to provide the inclusive and accessible environment, and to build the environment to provide the accessible, inclusive education for children with disability. That actually it is being done right now, and of course it needs to be propagated. It needs to be. There's a need to have more and more advocacy program. Awareness program is very much required. Today actually, madam, I have seen in the local newspaper that actually the Delhi government Department of Education, they are going to have one kind of assessment, and the Directorate of Education, they are going to map the entire education system, and especially all the inclusive school where the facilities are available for the children with disabilities, and they basically they need to map the inclusiveness and the facilities accessibility in terms of children with disability. So this is one kind of very motivating and encouraging a step for not for all of us, but actually it is other state also. So what should I do? Not only other state, even RCA should also do such kind of thing, because we are also having almost 1,000 training colleges and the teacher training colleges, especially those who are working for disabilities, especially for the PWDs. They are running the special schools. They need to map their resources, and of course to facilitate the system for provisions of the UDID cards. So that is very, very important that we are also doing. So I think now RC in the light of the NEP 2020, we are going to implement the various provisions or relevant provisions of the NEP 2022 to implement in our course curriculum, especially if we talk about the NCRF 22 or 23 that we are also going to implement. It means actually we are going to revise the existing course curriculum. Diploma, if you talk about the certificate course, we talk about the diploma course or the UG, PG and the B.Ed and level courses. Not only the teacher training program, but the other courses also, it is being revised, restructured in the light of NEP 2022 and NCRF. It means we are going to implement the credit system also implement, and the total number of hours as per the NCRF 2022, the minimum 1,200 hours is required for 1 year, complete 1 year, and 40 credits in a year for 1 year course. So it means actually it will have the complete uniformity across the country. And RCA has just taken the initiative under the chairperson, and we have advised all the training colleges to implement the NCRF and AP 2022 and incorporate the various provisions, especially the implementation of the credit system. That step we are going to do. Apart from this, actually, we are also going to implement or map the existing, the number of training, the human resources we are having. Recently, if you talk about we had a workshop in the Guwahati, and actually based on that, committee has recommended for convergence of courses, and we have done the convergence. And especially if you talk about the ASD, very limited number of training colleges are there, special schools are there, and of course awareness is very much required. So to create the human resources, so the courses are being converged as a part of the a composite courses has been converged, including the SLD, ASD and ID. So we are having now the persons with this background, they will be able to provide their services for not only for this ASD, ID and SLD also. That is very much required. Well, one thing I would like to also share. What basically RCA has done so far actually. RCA, if you talk about initially this ASD program has been actually, it was part of the MR or ID program, if you talk about, if you see, and we have been also taught like that this is a part of the MR or ID. Initially, later on, after the so many research has been gone, and completely now this is considered as one of the separate category of the ASD. It is also notified now actually in the RPT Act. So training programs are being developed at the UG and PG level, and that we are going to explore the different, the modules, training modules, short-term training modules. So in ASD area, and recently 6 months course on the ASD has been developed by the council, so that teachers, those who are having one teaching education qualification, they can undergo this course for 6 month duration and can have expertise as a teacher for the ASD. So this is all about. Since this is the part of the intervention, that I will just request to all of you, the participants, other stakeholders are there, special educators are there, maybe the training colleges are there. If they are having any queries or anything with regard to the RCA and what RCA can do and for upgradation or upliftment of the children with disability and in their training program. Certainly, we welcome all these ideas from all of them. So, with this request, Madam, just I will say, just thank you all, and I will request other speakers to contribute in the discussion. I will be here actually. Thank you, ma'am. Thank you.
Thank you so much, Dr. Subodh, for your valuable words. And so I'll continue, take the conversation further to Dr. Vikas, who's an occupational therapist. So I want that Dr. Vikas should speak about the role of like occupational therapy. What is the scope in autism? And so over to you, Dr. Vikas.
Hello, everyone. Very good morning, good evening, ma'am. And thank you, ma'am, to inviting me in this webinar. So coming back to what is occupational therapy. Occupational therapy is a field of habilitation and rehabilitation in which occupational therapist uses meaningful goal-oriented therapeutic exercises to make the individual independent in their ideals, work, and leisure. Here, ideal means activities which we do from morning till night, like dressing, undressing, grooming, bathing, eating, etc. Occupational therapy teaches you how to adapt. It can help you perform any kind of task at school and work or at home. Occupational therapy plays a supportive roles in other therapies like speech therapy, special education, and behavior therapy. Occupational therapist channelizes the energy of the child so that they can focus on their task or their therapy sessions. OT helps to strengthen the core muscles of the child, sitting span, attention span, hand function, so that they can perform well in school. Occupational therapist uses evidence-based approaches like sensory integration therapy and primitive reflex integration therapy. SI therapy, sensory integration therapy, is used to help children learn to use all their senses together, that is, touch, smell, sight, and hearing, movement, and pressure. It also helps in improving challenging behaviors or repetitive behaviors of the child. Sometimes these behaviors are related to difficulties with processing the sensory information. And other therapy, primitive reflex integration therapy, are primitive reflexes are automatic movement that happens without conscious thought. Primitive reflexes are the neurological building blocks of learned skills and motor development, coordination skills, cognitive skills, and behavior patterns. Integration of reflexes are important for developing motor control. A child needs motor control to maintain proper posture at a desk in school, to cross midline, read a book, and to write. So occupational therapists help in these areas with autism children.
So, so thank you, Dr. Vikas, giving us the scope of occupational therapy, how occupational therapy works in all the areas, and how it supports people with disability and children with autism. So I will be asking more about it, but let me just introduce the reach to the other panelists, and then definitely we'll come back to you with the question. You have already requested that you have a further appointment, important engagement, but give me 5 more minutes so that I can reach to other panelists. So our next panelist, Dr. Uttareshwar Pachegaonkar, is here, and as we know that Sri Aurobindo Society is doing a research in research in homeopathy in autism. So it's something very interesting study. So we will be very happy that Dr. Pachegaonkar if can share about it, when the research started and what is the research is all about. You have to unmute yourself, sir.
Yeah. Am I audible now?
Yes.
First and foremost thing we learned with this clinical study is that every case is an individual case. We just ASD, of course, we quantify it. We try to quantify it, but a lot of subjectivity is involved, and every case is really an individual case. Second thing we realized that there is utter lack of awareness among parents as well as among teachers. And therefore, the disorder is not identified at early age. The best thing would be if we identify it right before the schooling age. See, at the age of 18 months to 2 years of age, if we identify, and then management goes easier. We have done some retrospective studies of some people who have had this spectrum disorder, and wonderful examples. Like one example to every one of you must have heard that there was a dropout from school in Rajasthan from a very well-to-do and cultured family, and he dropped out of school in 7th standard. And he was allowed to take up farming, and now he's given Padma Shri for having innovative techniques in farming, and PhD people are going to him to study what he has done. I really wonder that time had some psychologists had intervened, he would have been labeled as autism spectrum disorder case and would have been treated, and definitely he would have undergone some sort of a depression. But see, he was given the scope and he could flourish. So every one of us know that these ASD people are not mentally retarded people, because I was the person who founded the first rural residential school retarded children way back in 1981. And there we realized that many teachers or parents, they used to bring these ASD children as mentally retarded children. Their IQ was wonderful. It was sometimes 110, 120 IQ, like they would have been Albert Einstein, but they were labeled as mentally retarded. So this lack of awareness is the second thing. Regarding homeopathic treatment, we have studied, of course, we don't have treatment based on the diagnosis. In homeopathy, we match the whole evolution of symptoms, the totality of symptoms, and match it with the drug totality, and we give the medicine, and it helps. See, it helps in the sense, see, basic thing in autism spectrum disorder children is their adaptability is not there. They always want to be in their comfort zone. Their adaptability is not there. They never undergo inhibitions. Now, why do you want inhibitions? We have seen some people, if they are lefty and the family insists that they should eat with right hand, write with right hand, and they undergo suppression. And definitely that takes toll in their performance. So same way in autism spectrum disorder children, it is the circumstances which actually enhances the gravity of the disorder. So if you take the count is minimal of the disorder, but the repercussions are more manifold. It is mainly because of the circumstances. The parents, the teachers, they fail to recognize, and they handle the things too much, so that the child undergoes a lot of suppression and rather a conflicting situation, because that comfort zone is not granted to the child. As against this, we have a case study where the boy was not interested in studies. The teachers reported to parents, and the whole family is, having array of educated people. And the teachers told that he won't even complete his matriculation. And somehow, being in a very rural area, he was helped to pass out his SSLC matriculation, and then his aptitude test was taken, fortunately, with one vocational guide, and they told he will not have academic performance because of this disorder. So you give him some technical line which he has very good aptitude. And he was given one course in automobile engineering, a certificate course like ITI. And there he got such a wonderful interest in repair of cars and scooters and motorcycles. And he developed so much that now he is around 50 and he has a car garage with investment of 8 crores with 50 people as staff members in him. See, this definitely, I'm sure that time had some psychologists analyze his case, they would have treated him as ASD. So what we have to do is, as a homeopath, we feel that we have to even treat the guardians, the mentors, teachers also, and train them. And I'm very glad that now the efforts are there, that we are taking up effort, conjoint effort to educate people. So treatment part is very little. Just we have to increase optimal adaptability, the socialization. Otherwise, they are not mentally retarded. And sometimes our friend, one more team is working in Bombay. They found out that their intuition levels are so much developed. They are far more superior than even normal people. Only thing is that application is the problem. So we have to provide wonderful circumstances. The parents, the teachers, and the surrounding people also will have to be treated along with the ASD child. This is what I would say.
So thank you, Dr. Pachegaonkar. So what I could understand that you wanted to say that in homeopathy also. So it's not autism. We have to see the individual symptoms and in children, because every child in homeopathy, we believe that every patient is individual. And in autism, we all believe in that every child with autism is different from other, because it is more of a heterogeneous disorder. So we have to take one person as an individual, and we have to homeopathy can help in the symptomatic treatment or certain comorbidities which can be handled with child with autism, because we all understand that the disorders are not curable, but we can very well manage the comorbidities. So thank you so much for sharing that. And now I'll be inviting Dr. Bandre, because now yoga has a lot of role in a lot of areas, and in past few years, yoga has been really getting popularized also. So I just want to understand from Dr. Bandre that how yoga is going to support children with disability and autism or the comorbidities. Over to you, Dr. Bandre.
Thank you, madam. Can you hear me?
Yes, sir.
You see that in America, there are a number of patients suffering with autism spectrum disorder. But in India, there are less number. Still, we get the patients as an individual. We start yoga administration after 5 years of age, after confirmation that the patient is suffering with ASD. And if they do something, there are two categories. One is severity, one is moderate. So moderate children can practice in a group of, in a big group of patients. And we teach them like something like teamwork, and they practice yoga very nicely. But in second grade, those who are severe affected, they required individual attention. So instructor of yoga required to understand one-to-one. So one-to-one teaching is sometimes difficult because patient has no concentration and coagulation. So the patient required attention individually. I tried my best to teach the many students. suffering with autism. Pranayama and asana, few asanas, not all the practices of asanas, especially difficult asanas are not carried out by them. Simple asana, like see, their neck is twisted. So the neck exercise repeatedly, we call it Brahma Mudra. And that can be helpful for them to develop their posture, correct posture. Breathing exercise, when they have sometimes congestion in the nostril, breathing exercise help them. Oxygen level in the brain increases by breathing exercise. And so they appear more active, energetic, sensitive, and suffering and more attenuated. Some initial stage we find the difficulty to draw their concentration on yoga practices. We take the help of their parents or the guardians. So I ask them to practice their all of the members of the family so that they don't feel that they are treated specially for yoga. So a group of the parents and the children, we give them training, and therefore they improve their ability to walk, balancing, balance, and the speed of walking, and flexibility in the limbs we found in by practicing yoga regularly. And to consistency of yoga practices is needed, and that responsibility we given to their parents. Parents are more eager to improve their flexibility, and improvement should be derived by them. So the parents are taken part in the practice of yoga with the patient. We found that when they do breathing exercise, they are more strong, and they don't cry for silly things. They don't shout later by practicing asanas and pranayama. And later on, when the advanced stage, we give them some concentration practices like Trataka. Tratak means concentrate on particular things for about without blinking the eyes. That Trataka helps them to improve their coagulation and concentration. They have lack of concentration because of this disease itself. So we found that gradually and consistently giving them practices for concentration, breathing, and asana, we found they are doing better than before. So one has to patient has to follow on long-term basis. That is what I experience. If you give them few months training, it's not enough. Years together, you have to follow the patient suffering with ASD. So this is what I have experienced in my teaching with the practices with the ASD cases. Thank you.
Thank you. Thank you, Dr. Bandre. So I'll come back to you again that how our neurodiverse population is what are the challenges to when you incorporate yoga with the typically growing people and the neurodiverse population. So I'll come back to you with that question. So I could see that I think Dr. Vikas has left the meeting. Maybe he can join again. But if you don't mind, because I will then pass on the question to Dr. Subodh, because he's the right person to give the clarity, because a lot of branches and rehabilitation like occupational therapy, physical therapy, ABA therapy. So these are very, very intermingling branches. So Dr. Subodh, can you give us the idea that how these are different and from each other?
Madam, I think actually if you talk about the occupational therapy and the physiotherapy and other kind of allied health professions, of course, more or less they are related to each other.
Mhm.
Because if you see the applications of the OT, if you talk about the OT or the PT, though I am not the OT experts, but actually, as I heard the panelist, the role of OT is also very important. If you talk about the ASD, so talk about the ASD, not only ASD, other disability. This is the part. They are the part of the rehabilitation team, not one like the OT, PT, speech therapist, audiologist, special educational social workers, special. So everybody is very much important. Clinical psychologists, and other allied health professionals. I mean, doctors. Right now, I have heard about the homeopathic, the research being done in the homeopathic by the medicine, and Dr. Saab has given very important things and findings. And actually, if Dr. Saab is there, he can also throw the light upon the what they have their findings about the comorbidities actually, especially if you talk about the ASD, that I wanted to know. And uh, the role is very, very important, ma'am. We cannot say actually, we cannot ignore the roles. This is a part of the rehabilitation thing, and not only the social rehabilitation, it is also the part of the is a medical rehabilitation, madam. Over to you, ma'am.
So, okay. So thank you so much, sir. So I could get that basically when Dr. Vikas spoke about it, that so occupational therapies mainly work on the motors, developing the fine and gross motor skills and the sensory integration part of it. And when we talk about the ABA techniques, it is more of a behavior modifications when we work, because these are the areas affected in child with autism, like social communication is missing, and then lot of sensory issues are there, and the behavior, lot of behavior because of this, lot of behavior issues are
Problem.
there, which needs to be dealt with. So and every branch is important. So it's so that's a message what I got from you, is that every branch is important in that. If the parents, they have to they take their child, so they make sure that they are covering all the aspect of child. So that's, and more above all, that special educator, when we are talking about the academic journey of a child for the studies, then definitely the role of special educator is equally important. So we'll discuss more about it, and then Dr. Subodh, one more question, because since we are working and when we say that a lot of we have around 80 lakh children with disabilities, and the resources are very, very limited, and this is also clear that a lot of students, around 45% of students are not able to get the education. So, sir, is there, as you were saying, that RCI is taking lot of new initiatives and working on NCRF 2022. So, something, will this issue will also be addressed, because this is one of the very, very core issue, that the facilities are not available for everyone.
Madam, actually, you have also spoken about the ABA,
Anji,
applied behavior analysis, I
analysis,
think.
yeah, yes.
So, madam, of course, actually, this is the, and we all know that actually there are so many problematic behaviors are there, with the children with disabilities, and maybe in case of ID also, on associated disability also. So just one humble submission to and advice to all of the stakeholders, and from RCA side, I will say, there are at present, actually, I have heard so many ABA courses, short-term courses are going on. Actually, they are self-claimed certified the ABA therapist kind of thing. So parents and the stakeholders should be aware about that. They for before getting any kind of services from any so-called specialist, they should be aware about that. Actually, there are certain the minimum standard which needs to be maintained by a professionals, and how can you assure authenticate the professionals? It means they need to have some kind of license from the RCA. So for each and everything, like the professional bodies are there. If you talk about the OTPT, they are having their own regulatory bodies, and for our area, we are having own regulatory bodies. So actually, in case we talk about the if the problematic behaviors or any kind of behavior analysis or behavior therapist therapy to children with disability. So it needs to be implemented and administered by the qualified, either psychologist or clinical psychologist or rehab psychologist. Must we have the RCS certification for the safer side. Otherwise, so many short-term courses are there, like they are self-claimed that they are, and we know the quackeries are going on, and so many clinics are also functioning and mushrooming nowadays actually. This is my submission. So for the parents and the other stakeholders, and if you just rightly say that the number of disability and the 80 lakh special children are there like that. So madam, recently if you talk about the Union, Rajesh Pandey and Union of India in the court matter, and Supreme Court has given the decision that and directed to all the state government to appoint the qualified special educators with the RCA certification. All the schools, each and every school, at least one qualified teacher should be in each every school. It is must there, and as per the guideline, actually, our ministry, DPWD, and they have, they had a series of meeting with the experts and panelists. And we also developed the PTR, also people teacher ratio. So that is also submitted. PTR means for the primary school from class 1 to 5. What is the PTR? People teacher ratio? It should be 1:8, and the higher from 6 to 10, it should be 1:10. So that guidelines ratio has been decided. The documents have been submitted to the Department of Education also. And of course, we have also developed the norms for starting or how to set up a special school for children with disability, for the different disability, for the hearing impairment, ID, ASD, and the visual impairment, hearing impairment, multiple disability. It has been developed. We have also submitted the the Ministry of Education. So that this is all as per the guidelines and directive of the Supreme Court decision. So state government are also doing on the things. Now we have to. So as a result, you see nowadays in the Bihar government is today actually. Last week we had a we have seen 1,75,000. The 7,800, almost 8,000 special educators are being recruited by the government of Bihar. The same thing is being by the 8,000 special educators are being appointed by or engaged by the government of Gujarat. Other state governments are also planning, because it is mandatory to implement and mandatory to be complied by all the state government. So, of course, maybe in a few years, we'll have the qualified teachers each and every school as per the guideline of the direction of the Supreme Court. So this is all about that.
Thank you so much, sir. I totally agree with you, since we have been working with a lot of state governments. Project Inclusion only work with the state education department, and everywhere the recruitment of special educator is happening. So definitely government is really taking solid steps in this regard also. So sir, one more, I think just want to understand that is there anything available, the course available for the parents also? RCI has designed something or planning to design something for the parents?
Madam, one thing, it is very relevant question you have asked. And but one thing I got to say, the state government, they have planned to appoint the qualified special educators, but at the same time, it is mandatory for them, the special educator, to undergo the to qualify the seated or a state education test examination. So that for the stakeholders, those who are established with the council, I will just, it is my submission, advice, they should also qualify. Otherwise, now they are qualified, they will not get a chance to work as a special educator in the government setup. That is very much clear. Ultimately, it is binding, applicable for everyone. And you talk about the any kind of short-term program for the parents and stakeholders. Of course, madam, actually, we are going to we have developed under the central sector scheme the short-term training program for the stakeholders, government functionaries at the grassroots level, education functionaries also, and even the higher senior government functionaries also, allied health professionals, grassroots level, Anganwadi worker, Asha worker. That is basically to to facilitate about the disability matter and how to make the environment or workplace inclusive. That is the so short-term program, 1 day or 2 day durations are there. We have developed the course content also, that is also available on the council website. And apart from this, the short-term 3-month program through the ODL mode it is also going to launched by the IGNOU. Recently, we had signed an MOU. The council has signed an MOU with the IGNOU and to conduct the B.Ed and M.Ed special education program through the ODL mode with the different disability specialization, and of course the certificate course that is known as the awareness and training program for the parents for the children with disability. Basically, it is made for the parents and those who are working. They can also do this course. That's very, very important. This program earlier we conducted in 2014 4 also, and that was considered as a foundational course recent, and now actually it is being implemented. The IGNU may run this program from the next academic session, May 2020-24. And that's very important. This is need of the hour we are doing, and let the parents should go. In case the parents needs to have some sort of program to run immediately, they can write us. We can also provide the platform to undergo the program.
Thank you so much, sir. So that's really important, and thank you so much for bringing it up. So I'm because we have a very less time left, but I'll quickly go to Dr. Pachegaonkar, because even we really want to know the what are the outcome of the research, like since in autism has a lot of comorbidities, like anxiety is there and other aspects are there. So just wanted to understand what are the areas which were taken care by homeopathy when when the autism the medicine were applied. And secondly, is there any group of medicines which came which were actually working on these children? So if you can really quickly address these two things.
Basically, what we have done is some symptoms are like what we can mental disposition of the child. Study based on that, and some symptoms are secondary. Maybe like child has been subjected to trauma or some sort of strong inhibitions. Based on that, and not only that, these children are even target for even abuse. Therefore, based on that, we devised our remedies. But surprisingly, like you being homeopath, you can understand phosphorus is the remedy which came in some children. And phosphorus is supposed to be like hyperactive person, very intelligent, very receptive, very sensitive. But sensitivity can become again a sort of make it the child vulnerable also. So phosphorus, because they come under influence, but at the same time, they want their own comfort zone. They are very blunt sometimes. They are very open, extrovert. And once the children suffer because of this, and then they undergo inhibition, they just go into their own shell and prefer to remain in their comfort zone. And then they really become taciturn. So phosphorus as a remedy has helped. In some children, like where we call restlessness, they are restless. Zinc met has helped them to calm them down and be focused in one thing. Another thing is sometimes we have even seen that Staphylococcus aureus also has come as a remedy, where they are always reprimanded by the people before the things are detected and they are diagnosed. There are always people try to reprimand and be a strict disciplinarian, be it their teachers or even in kindergarten class also, teachers try to discipline them. And then even Staphylococcus aureus has worked, and Staphylococcus aureus helps them to overcome the inhibitions and mortifications, and then their behavioral changes occur and their adaptability is much better. Rather, they are able to communicate, because what happens, they go into their own shell, they hardly communicate them. Their even displeasure, they don't communicate. So our remedies have helped them to communicate with the parents or the teachers or the caretakers. And therefore, these remedies have helped. Hardly any remedy child required Baratakar.
Yeah.
Here, we have a case where at the age of 5, the child was thrown out of KG school. The teachers told, in ashram school, the proportion of the teachers is very good. Every 4 children have 1 teacher.
Great.
And there they complain that this child is unmanageable. We need 1-to-1, and it's even the parents of other children complained that a lot of energy is sought by this child and throw him off. And then he was thrown out of this. But luckily, one-to-one education was given for 2 years in Bangalore, and the child has come back in mainstream school, and the boy is on 16 years now. Last 8 years, he has been performing at par with other children, behavior
Oh,
wise
great.
Great. It's
and performance wise also. So
great.
homeopathic remedies do help.
Sure.
This is an
So-
example.
So, Dr. Saab, you says that the phosphorus is very, very important and relevant for them. Do you prescribe any kind of medicine for them, Dr. Saab?
Yeah, these are the names of homeopathic medicines we prescribe in children.
Okay, so that is very helpful for them.
Yes, phosphorus, ginkgo med, staphysagrina, these are the remedies which prescribe.
So I agree with Dr. Pachegaonkar, because I, being a
If you
homeopath, I
happen to come
yeah,
without-
so I understand that. Then
identity you can have interview with a boy now who is in mainstream school now, performing very well.
Great news.
बेटा नहीं मम्मा कुछ बात सुन रही मीटिंग हो रही है
so quickly I am coming to Dr. Bandre. So Dr. Bandre, when I because whatever you said that there are many aspects of yoga and meditation help to reduce the anxiety, to the restlessness, but the main problem is that how to inculcate that yoga in children, because they have a lot of, because it's what are the challenges you faced and how it is dealt. That's more important, that how to inculcate yoga in children with special need.
You see, yoga is the practical aspect, and we found that when some asana of balancing in standing, some sitting, and some lying down, they are helpful for them. Once they have discipline to start yoga practices, every day they will look forward. These two children suffering with ASD, they are very much interested. Once they understand the benefits, they keep continue their practices. And we found motor coordination, body awareness, focusing on concentrating on the words given by their parents are more improved. And a lot of studies in America found that yoga is very much helpful to improve overall improvement in the patient suffering the ASD. And we found that the immune system is also increased. Their immunity in autoimmune is again improved. I think with homeopathy, if yoga goes together, results are wonderful. Rehabilitation is 80%, as I see it, because I am also found that the medicine with homeopathy and yoga, the combination is very result oriented.
We tried with deep breathing exercises and Om chanting with them. Like we used to have like a chorus. We never asked child alone to practice it, but in group we tried to practice, and that really helped them to calm down and concentrated in.
They're balancing text. Mentally they get more attenuate with practicing pranayama, concentration, meditation practices in advanced stage. After few months of regular asanas and pranayama, then we introduce meditation, which improve their cognition and behavior towards the parents, teachers, and colleagues, siblings, and it was very encouraging to us. But only thing, the hard work is to be carried out by teacher to follow them every day, because they are sometimes disobedient students, we can say like that.
Lekin, Dr. Saab, I'd like to say why actually the one teachers has to follow. Let the parents also should follow. They should also learn how this yoga is being performed.
Yes.
So they can also implement at their home. That is very, very important.
So
Earlier I told him that teacher not only teacher has to be practiced along with the child and parents also. So that
Yes, Dr. Saab.
so yeah.
These practices are good for everybody.
So
not for
I'm
only ASD patient.
Now, along with this, what we advise is, along with homeopathy and these breathing practices, we advise even the day regimen of the whole family. We suggest that they should finish their dinner before 7 and the child should be in bed by 8:30, 9 o'clock.
Yeah.
In the evening. This lifestyle also we do advise, because these things do help. And you can't ask the child to eat dinner early and sleep early. The whole family has to develop that culture.
Same thing with the yoga also.
Yes.
So
Yoga
I really
is
get
to
it.
do.
So I'm sorry, I'm running short of time because time is running, and so I just want to conclude whatever the discussion is. First of all, as Dr. Subodh said, that RCI is taking a lot of new initiative, especially convergence of few courses like SLD, autism, and intellectual disability, as they're coming up as a one course rather than the individual courses. And it is, and they are they are starting 6 months ASD program, so course. So that is great. And whatever from the today's discussion, before taking that, there are a lot of questions from the audience, and most of the questions from the teachers and parents, that how we can identify child with autism, how we can identify intellectual disability. So one thing I just want to understand, I want to tell them here that we as a project inclusion is actually creating awareness, and through the teachers we are reaching to the parents, and connecting all the stakeholders together who are working here. So teachers, who, if you really want to connect to our program, the program is running in 20 states, and we are especially working with state education department, which will help you to understand the basic of inclusive education, and all the neurodevelopmental disabilities and disorders, and the classroom strategies which you can use with the children. We are put universal design learning, that how you can teach all the children together. So kindly, there is we have sent the link also. People who want to join us, they can follow us on the Facebook or other social media handles. And with that, and what I from other everybody, I could sum up that there are 3 or 4 things are very, very important. First is, there should be a holistic approach to deal with the child. Nothing
Very
one.
important.
Not one aspect covers everything. So when in terms of therapeutic interventions, in terms of other conventional and or non-conventional programs, everybody has to come together. So yoga and other aspect will only be beneficial once the child has gone through the basic intervention, like occupational therapy and AB, so that they are making the ground, so that there is an acceptance for the child to accept all these therapies, and then there is a result. Second thing is very, very important, is that all the stakeholders has to come together. It's not only the duty of a teacher, not only the duty of a parent and the other expert. If we really, really want to bring change in the communities, we have to be, our community have to be more inclusive. Parents have to come from the acceptance, from the denial. Sabse bada, there is a reason that once the teachers, if the teacher identifies the child in the classroom, then the parent has to listen to the teacher and accept, and kindly follow the instructions, kindly meet the expert to know about it, rather than we are denying it. It is not going to yield any result. Second, other way also, sometimes the parents are coming to the school and they are telling the teacher, this is the issue, this is the learning difficulty my child is having, kindly create that environment. Then the teacher has to come forward. It has to be more of a partnership model, where everybody has to come together and understand, and only then the child will be benefited. And third, Dr. Subodh said very rightly that lot of courses are available. So we need to be very, very clear that what is the source which is coming, especially for the professional. I want to take his voice, that those who want to attend any workshops or courses, make sure that it is coming from the right source, so that they are actually benefited. So thank you. I think with that, we conclude today's session, and I really want to thank you all the panelists and our chief guests, that you really bringing out your valuable time, and became the part of this important discussion. And hope to see you next time also, when we'll be coming up with something more important and beautiful. And I really want to thank you all the audience who have been connected with us from any media that and I hope stay connected to us. We will be bringing more and more such informative programs to you. And for otherwise, if you have any queries, please write to us. If it has not been addressed by the panel, please write to us. We will be sending the queries to the right panelist, and we'll be getting the answers, and definitely will get back to you. With that, thank you so much being here.
Thank you, Simmi ma'am, and thank you all the panelists. Today it was a very wonderful discussion, and of course it was the need of the hours. And of course we should know about the project inclusion and initiative by the Aurobindo Society. And of course, actually, your role is very important. You have done a lot of Aurobindo Society has been doing a lot of things. So thank you very much for bringing us together. And of course, it is a message from us or all of us, and for the parents and stakeholders, that you should have, if you want to, improve the quality, to make the children with disability rehabilitate, or to improve education, make the educable. Of course, we need a certified or a qualified practitioner, of course, under a inclusive environment. And of course, the role of the doctors, medicines, homeopathy, yoga, that is amazing. So I must acknowledge. And I must acknowledge you also, ma'am. Thank you very much from my side. Thank you very much.
Thank you.
Thank you. Thank you.
Thank you.